I really try to prioritize active listening, being empathetic, and trying to hear the whole story and trying to let people know that, I'm not just interested in hearing a problem and prescribing a medication. Like, I'm really interested in in your life and like how I can help make your life better. Even if I can't fix it, I'm interested in hearing about it. Because I think that, to me, that's the most interesting part of the job, is those relationships. And then I've come to recognize that, really effective providers are the ones that are good at making those trusting relationships.
Welcome, everybody, to another video we're doing. Alex, it's great to have you here. Guys, we've got Dr. Alex Nielson, who is with us today. We wanted to do this kind of video series because we think it's really important for patients to get to know their providers, and that's really hard to do in a clinic visit, But I really believe that doctor-patient relationship is like one of the most important things, and it's a two-way street. We really need to know our patients, and they really need to know us. So with that, let's get into it. Alex, why don't you tell us a little bit about kind of yourself, your background, your training, kind of tell us as much of that as you want to share.
Yeah. So I am a Beaverton native,
Nice.
So I'm from the Northwest. And I grew up in a family where we really talked a lot about service in our community and trying to help other people. And so I kind of grew up with this service ethic as part of my my childhood. And when I was in high school, 9/11 happened, and I kind of felt a calling to serve in the military at that time. And so that kind of took over like the early part of my 20s. I enlisted in the Navy at 18 years old.
Wow.
And then I became a Navy corpsman, which is like a medic for the Navy and the Marine Corps. And as part of my training, I was able to get assigned to 3rd Marine Reconnaissance Battalion in Okinawa, Japan. And that was where I started to work in medicine, basically. And my first experiences were taking care of Marines, on deployments in Iraq and Afghanistan, but also just in routine healthcare back at our battalion. So that was kind of my introduction to medicine. And I had a really close relationship with my doctor that was assigned to me in the military, and kind of inspired through my experience with him to pursue a career in medicine as a physician. Wow. Yeah.
That's amazing. How long were you you said you were overseas in Japan. How long were you overseas?
So my duty station there was for 3 years. Wow. But I only spent, I think, a total of less than 2 months consecutively on the island, because we were just so busy.
Oh, wow.
Because that's where that was my home, but then we would deploy to Iraq from there. And that was 8 months. And then we deployed to Afghanistan from there. So we'd come back and go. And then we also did a couple of operations in the Philippines and Southeast Asia.
Oh,
so we were just very busy. It was a very busy time. But yeah, I lived there that was my mailing address was in Okinawa, Japan.
That's
for
amazing.
3 years. Yeah.
So for 3 years you were abroad.
Yeah.
And sorry, what branch again it was?
The Navy.
The Navy for 3 years. Oh my gosh. So overall, was that a positive experience? Did you like that? Yeah, it was.
Yeah, for me, it was really, when I started out, I knew I wanted to be of service. Like I knew I wanted to do something to help our country at the time. And I felt like really called to be a patriot and do that. But I didn't really have a lot of direction in terms of like what I want to do as a career, or as in terms of education, like where do I want to go? And so I feel like that time was really formative for me, and just the people I was able to work with, the experiences I was able to have in and around medicine, because that's where I found that's basically where I found the calling to go in as a physician. And it wasn't one single event that happened. I think it was mostly just seeing that, not only can you can help people in really important ways, but also the science behind it and the really interesting work that people do behind the scenes too.
Dang. So 3 years overseas, and then you come back to the States, right?
Yep.
And then what happened from there in your path?
So I decided during the last year that I was in the military that I wanted to become a doctor. Mm-hmm. And so I started, I didn't know how to go about doing that. So I basically got advice from the doctors that I was working with there. And so I enrolled in the University of Maryland for my undergraduate studies. And so I got out of the military in the summer in July, and then I started classes in August, of the same year. Yeah. So there was a big culture shock for me going from, a Marine reconnaissance platoon to being in a big concert style lecture hall at the University of Maryland. But yeah, so that was the step that I took, and I kind of knew where I wanted to go. So I just talked to the counselor there and got signed up for the pre-medical courses that I would need. And I really enjoyed undergrad. I had a great time. Dang. Yeah. Learned a lot of stuff.
And then so from Maryland, I think you said you came back to Oregon eventually, right? To finish up your training.
Yeah. I loved my time in Maryland, but it made me love the Northwest more.
What about it? What particularly? What about the Northwest?
It's just where it's my people, the culture out here is very different than the Mid-Atlantic. And, I was raised on the weekends, we were in the outdoors. Like we would go either to the river to go fishing, or we'd go camping, we'd go to the beach. Like there was this very, very close connection with nature just from my upbringing. And they have beautiful places back east, but there's a lot of development. And so I really missed just the geography of the Northwest. And I would tell people like, yeah, let's go canoeing or something. Yeah. And people are like, who's this crazy guy? And it's just like, it's a different world. And so I knew I really wanted to come home. Yeah. And so I really wanted to go to OHSU. So I was really, really glad when I got accepted there.
Dang. Yeah. I love how you talk about your people and like your calling to be home. And if you're talking about hunting and fishing and canoeing and all those things, this is the place, know? And so in talking about that, I think, talking about your people, I think that gets to a really cool thing in medicine where like the relationship aspect is so important. Yeah. And, I'm sure like you can connect over, there's a lot of Northwest people who like similar things to you. And now not only are you their doctor, but you've got that relationship with them on these outdoor things that kind of all make us part of the Northwest. So what would you say is sort of like kind of the most important thing or the keys that you have to establishing those relationships with your people, whether they're, Northwest natives or not?
Yeah. I mean, I think for me, the thing I was taught in school and the thing that still to this day I just think of as the most important thing is trust. I mean, there's an element of trust that you can experience with a good patient-provider relationship that is just, it's one of the most special parts about this job. And then you can see the other side of that is when you don't have that trust, you can really kind of struggle along the path with patients. And so I really try to prioritize active listening, being empathetic, and trying to hear the whole story and trying to let people know that, I'm not just interested in hearing a problem and prescribing a medication. Like I'm really interested in your life and like how I can help make your life better. Even if I can't fix it, I'm interested in hearing about it. Cause I think that to me, that's the most interesting part of the job is those relationships. Yeah. And then I've come to recognize that, really effective providers are the ones that are good at making those trusting relationships.
That's so powerful, man. I think just the point of like, the medicine is cool and it's interesting and the science is interesting, but it's the people and the quest to make someone's life better that makes the job like a calling. It sounds like that's kind of your ethos as it relates to being a doctor.
Yeah. And we get such a privilege to walk with people through these journeys they go on, and usually just by nature of our job, we meet them in places that challenging, places that are dark, and you really get to see when people trust you and they share these parts of their lives with you or the struggles they're going through, you get to see the true like strength in people. And it's amazing to watch people, have a health problem, figure out how to work through it, and then start making progress. And just seeing that and being a part of that is such a cool part of this job. And it's something that, I learn new things about every day. And it doesn't take much to, when someone's in a hard place, it doesn't take much to to misstep and have trouble with that trust in the relationship.
Yeah.
And so I've also, I've tried to meet people where they are. I try to make sure that we don't have miscommunications and just check in on folks too if I don't see people for a while.
Yeah, man, that's incredible, man. That really is. I mean, I think we're all searching for that kind of a doctor. Just to be perfectly honest with you, that is, just interested in the person for them. And how can you help them? And there's a couple of things you said that I want to kind of probe further on. And one is that, obviously the relationship is important, but really it's a part of, there's a whole, it's clear to me you sort of have like a philosophy on patient care. Like if someone were to come up to you and say, tell me more about your philosophy to patient care, like what is your general approach? Maybe that's exactly what you just said, but I'd love for you to tell us more of like, when I go to see Dr. Nielson as my doctor, I know this is the kind of approach he takes with me.
Yeah. I think what I've learned is that it needs to be tailored, like care needs to be tailored specifically for each person with their personality and with their health issues. Ideally, the way I would love because most of the things that I deal with are more of a chronic condition. So this is something that people are going to live with. And so ideally, when I see patients have the most success with those types of conditions, it's when they pretty much take over. And so I want a patient to understand what's going on, why we would recommend a medication, what they can expect in terms of benefits from that medication, side effects from that medication, so that they're just as informed as, anybody else would be. And when they take ownership, when you see them take ownership over these things, those are when you really see the most success. So I try to kind of I try to use storytelling and metaphors and try to get people to understand what's going on with their body and why we're running tests. Because I think if they understand, then they kind of take ownership over the problem in a different way. So I think that's kind of my ethos with it, is just like, how can I get the patient to understand enough of this so that they can drive the ship more? Yeah,
you're more of the teacher as opposed to the drill sergeant.
I try to be. Yeah. I've had a drill sergeant. So.
Yeah, you've been on the other side, I guess. That's fair. Yeah, well, that's so good, man. I mean, I think, I think this is their patient's story, and you're there to guide them on their own journey, and they're gonna, it sounds like you're trying to educate them so that they can make whatever that best decision is for them, and that may be different for different people.
Yeah,
that's awesome. That's good, man.
Yeah, absolutely.
One other thing you said, you kind of alluded to, is sometimes people are in dark places. They're in tough spots when they come to seek out help from us as doctors. And it's amazing, not only the things that we ask people and expect them to give us honest answers, but the things that people will tell us, unsolicited. And it's really like a privileged, I don't want to say sacred, but it's like a very special relationship if done the right way. But things obviously can be touchy, dark, tense. How do you deal with those difficult conversations that we need to have, but sometimes can be uncomfortable, but necessary?
Yeah, I think this is something that's close to my heart because, I've had issues in my life too. And I think for me, a really nice thing to be able to do for patients in that situation is understand what they might be feeling, in terms of, maybe being reluctant to seek care, or when they do seek care, feeling judged or stigmatized based on a condition. And so I think those are the most interesting cases for me. One thing I really try to emphasize when it comes to making lifestyle changes or behavioral changes is the concept of progress, not perfection. And so I think a lot of times people feel like they have failed or feel like it's an impossible change. It feels like it's just too much to handle right now. And so one thing I think that can be helpful is just like making reasonable amounts of change within the dimensions of your life that you have control over, and setting people's expectations. We're not trying to turn you into a triathlete overnight or something, like we want you to achieve your goals, but we also want to support you through that. And we want this to be like a lifelong change, in other words. And so I try to just help people understand that, we do have setbacks, and we do have to start over on certain things, and that's okay. That's all part of the process of change, and I have personal experience with it, and I'm happy to talk with patients about that too. But I think this is one of the parts of the job that is, it's one of the more challenging and also the most rewarding part. Yeah.
I love that you frame that, because I think oftentimes we as doctors put unrealistic expectations on people, and one of my favorite quotes is progress is happiness. If you're continually chipping away at something that's important to you and seeing progress, even if it's slow, but it's consistent, I think we all feel better about ourselves when we know that we're chipping away. I think sometimes, myself included, we push people too hard and set unrealistic expectations and sort of helping them chip away. It's a marathon, not a sprint. We're not going to turn them into a triathlete overnight. So that's super good, man. I love that.
Yeah. It's, and the other thing is, a lot of the real nice thing that we have is we can work on this over time too. Like we don't have to, do everything in one appointment. We can work through this over a series of weeks or months. And usually as that trust builds with patients, then you learn more about them, they open up more. And so oftentimes just taking it slow, working on one thing at a time is actually the most effective way, because it lets you get down to the underlying conditions,
Yeah, for sure. Sure. That's so good, man. Yeah, you're the best, man. You really are the best. So I want to know more about you as a person, clearly, as if anybody has, all it takes is 30 seconds to listen to this to realize you're an incredible doctor. And I mean that, you are an incredible physician, and any one of us would be lucky to have you as our doctor. But you're more than just a doctor, you're a person. So a couple things I want to know about Alex, the person, or Dr. Nielson, the person. What's something that maybe you would love to tell patients about yourself, or that you would want them to know about you, that's sort of hard to tell in the course of a 30-minute appointment because we're focused on the patient, but what's something that you would want your patients to know about you, the person?
I think one thing is that I like to whitewater kayak. I don't know if that...
Wow. I do not know what separates kayak from white. Tell me more about what that means.
It's kind of weird. And it's kind of dangerous. So I'm not super, I don't wear it on my sleeve, but there's these amazing rivers we have in the Northwest that have, they have rapids in them. And so we take plastic kayaks and drive up into the mountains and float down these rivers. And you learn how to, flip the kayak over upside down and then ride it and do all sorts of cool things with it. And it was such an obsession of mine throughout my 20s, early 30s. I've been all over the country doing it.
Really?
Yeah.
Where's the best place?
Well, the
Other
best,
than the Northwest,
the best place is the Columbia Gorge, I think. But the best experience I had was I had the opportunity to guide a blind kayaker down the Grand Canyon.
Oh my goodness.
Of the Colorado River. And so his name's Lonnie Bedwell, and he's gone on to do all sorts of extreme achievements in outdoors. He's climbed lots of mountains, including Everest and stuff. But this is before he was doing all that. And I just almost by random chance met him at the start of this river, and then learned how to paddle with him and learned how to guide him through rapids. And so he became the first blind kayaker to paddle the whole Grand Canyon.
Oh my God.
So he paddled these really big rapids, and it was the most amazing, transformative experience. It was so cool.
Man,
but he wrote a book, and then I actually wrote the forward for
what?
it. So yeah.
All right, what's the name of the book?
Oh man.
Or is this his name? So people could
Lonnie
Google it.
Bedwell is his
Lonnie
name.
Bedwell. Okay.
Yeah.
I did not know that.
Yeah. It's a super, super exciting part of my life, but it all kind of happened on a whim. But yeah, I was his guide. That's
incredible. I got to check this book out, man. Yeah. That's amazing. Yeah. You should add author to your CV. That's pretty cool. I think that story that is incredible, because that gets back to what you just started with at the very beginning, which was service. Service. And here, even in your personal life, you're serving others, and clearly with this Mr. Bidwell, made an incredible impact. Like that's incredible. Other than whitewater kayak, which I got to be honest, sounds very scary to me. I am a chicken, so good on you for being able to do that. I could not. My wife would probably love that. I couldn't do it. What else do you like to do for fun outside of work? I
mean, I just kind of the smorgasbord of outdoor stuff I grew up with. My 3-year-old daughter is now, she's the most important activity, I guess you would call outside of work. So we're doing all sorts of things. We go camping and hiking with her and take her to the beach and just do a whole bunch of outdoor stuff. And then my wife likes to do just kind of the normal outdoor stuff with me. So we just do everything kind of like a family. My family still lives down in Beaverton, so we go visit them quite often too. So
you are meant to be in the Northwest, man. That's so cool. Well, I want to close with one question about I think sometimes it's, primary care especially is hard. Medicine is hard. There's oftentimes, I think, only negative stories really get promoted. I think it's cool to hear about the success stories. I wish the news would tell more good things instead of bad things on the news. So I'm just curious if you have like a favorite patient success story that you might want to share with us.
Yeah, that's what I was thinking. It's hard for me so this patient was successful, and I was a witness to this success. I played a very minor role, but I had a patient who, during kind of the height of the pandemic, he ended up, his health was not doing well before the pandemic, and he ended up having a prolonged course of COVID. He was admitted to the hospital, and he got, his body got riddled with these clots. And so he was just, and he was spent a long time in there, had to go through some pretty invasive procedures just to keep him alive. And he discharged from the hospital and was just kind of in this, he was in a dark place. He was he was in the middle part of his life, and he was just like facing these really big health issues. And it was happening at a time when we were all under social isolation. So it just seemed really bleak. And so we sat down and we talked, and when he had discharged from the hospital, he got put on a bunch of different medications, some diabetes medications and blood pressure medications. And he was like, listen, I don't want to be on these meds. Like, I don't know what to do, but it felt like his life had kind of, like the autonomy of his life had been taken. And I was like, well, you don't necessarily need to be on these, but you're going to have to make some changes. And he was like, what do I need to do? And so we talked about it. And over the course of a year or so, he lost so much weight. He reversed his diabetes diagnosis. He reversed his blood, his body, all of the chronic conditions that he had been admitted to the hospital with and that had led to this severe case of COVID, they all resolved with his lifestyle changes. And so he would come in frequently, and we would watch his numbers improve, and we'd check his blood work and all of these major issues that he had been dealing with for years, just kind of thinking that was just part of, getting older and that kind of thing. Things just improved so much for him. And I still see him from time to time, and he's doing so much better.
Wow.
Back to work, back doing the job that he loves.
Oh my gosh.
Yeah. And so, it's one of those things where it's a great example of like, he trusted me that he could get off of these, and then he did the hard work, but he was willing to have trust and just to make these changes. And so I think I've been working with him for several years now, and he's still doing great, and he's still kind of just chugging along. And
that's awesome.
Yeah. So that's my favorite story, and I still kind of feel amazed that I was able to be a part of it.
Yeah. Well, that's incredible. I mean, I think you get to, like, the science of reversing type 2 diabetes is interesting or whatever, but losing weight, reversing pathophysiology, getting off medications. But more than that, I mean, you were there for him. And like, I mean, even if that wasn't COVID and social isolation, that's like one of the worst possible things. Then you add that.
He lost his job. He lost all of these major things. I mean, medical care is a big issue for working folks, you know? And so, just to see him come back and thrive, you know, after these health changes, it's amazing. Yeah.
Well, that's so cool, man. And that gets to something that I wanted to say before we left. Two things, but what you just said reminded me of, you know, just the power of a good doctor and what that can do for people, and how we can really have a positive impact on people's lives. And clearly that story is, I'm sure, one of many for you, but it's a perfect example. And I can vouch for Dr. Nielson being an incredible doctor on multiple different, levels. But I think a story that perfectly encapsulates this is one day I was seeing one of Dr. Nielson's patients, and he had referred him to me to go over some stuff, and we were talking to him, and somehow your name got brought up, and the guy said, "Oh yeah, Dr. Nielson, that guy is bad ASS. I effing love that guy." And of course, he used the swear words, but unsolicited, just came out and said that. I'm like, that is the mark of a good doctor. When some guy who you could imagine probably would never want to be at the doctor's office, but is here anyways, and he's bragging about his physician, who is you, Dr. Nielson. So, Alex, we really are so lucky to have you. And I really mean this. Not only are you an incredible doctor, you're a really good person. And I feel so fortunate that, not only am I able to go to work with you, and our patients are able to be taken care of you, but I know our patients are very thankful for you. There's lots of doctors that are smart. Not all, but lots of doctors are smart. And obviously you are very smart. But you're a really, really good person that genuinely cares about people. And it's very obvious to anyone that spends any amount of time with you. So thank you. And I think Longview often, and Cowlitz County often gets a really bad rap, and people don't want to come here to serve, our patients in our community. And so I think doctors oftentimes don't want to be here. And we are really lucky that you are here, because you are really, really a fantastic physician. So thank you so much, man. We're really lucky to have you.
Yeah, thank you.
Awesome.
Yeah.